share my screen in a moment and introduce Dr. Aluko herself. We go. So Dr. Mrs. Seun Aluko is her name. She has an MB CHB, for those of you that can interpret what that means, and an MPH also. She is a charismatic leader and a teacher. She's a motivational speaker and a prolific writer, actually. I like the way she introduced herself. She's born, raised, bred, built, and trained in Nigeria. She now resides in Columbus, Ohio, with her husband and her children. She holds a degree in medicine and surgery from the Obafemi Awolowo University, Ile-Ife, Osun State, Nigeria. I mean, this is a proud Nigerian right there. She has a master's of public health from the United States. She worked as a medical doctor in clinics and hospitals. Is an instructor in healthcare colleges, a public health professional. Not currently, she is a very proud program manager of infectious disease investigation and outbreak response at the Columbus Public Health here in Ohio. She's fondly called Dr. A. She's a visionary of 5 o'clock. It's a session she does, a platform she sets up to create awareness about common diseases and health issues. She teaches prevention practices, points individuals to health resources, and of course, educates them on how to thrive in health and in life. Passionate about getting voice for the voiceless, presented different health topics to various groups, including health workers, immigrants, elderly and retirees, young adults, women, and so on. At her leisure, you can find her cooking, writing poems, singing, dancing, and hanging out with friends. So with all this, she still has time for life. It's beautiful to welcome you, Dr. Aluko. You're welcome. You can take it over from here.
Thank you very much. I really want to appreciate you for having me here to present. With restriction, I want to say having me in your platform, because this is supposed to be my platform as well. I'm a proud Nigerian, as you have heard from the introduction, and I am supposed to be a part of NIDOA, a passive active member. Let's put it that way. Anyway, so it's a pleasure, to be in our midst today, to be in the midst of people that have the same accent as me, the same set of people that I don't have to hide anything from, the same set of people, that were raised or probably, have an affiliation with the same origin as me. So it's a pleasure. And I really want to thank the organizers of this for inviting me. Like we all know, the presentation for this day is mental health awareness. May has been set out to be the Mental Health Awareness Month. And it is so heartwarming to know that NIDOA as an organization is setting a day apart to have a conversation about this very, very strong issue, especially looking at it from an African perspective, a Nigerian perspective as well. How do we see mental health from Nigerian perspective? How do we see mental health as immigrants, as Africans that now live in the United States? So I'm really appreciative for this opportunity. In one word, thank you for having me once again. Now, let's go to the next slide. Before we start this presentation, I want to ask a question. When you hear about mental health, looking at our background, your educational background, your background where you were born, raised, and trained, how you church, your religion, what comes to mind when you think of mental health? What picture do you see? What word? What will be the first word that will come to your mind when somebody said mental health? And I will, advise everyone to put their thoughts in the chat box. If you can access the chat box, put whatever comes to your mind when you think of mental health in the chat box, and we will be looking at this, shortly. Next slide. So I'm going to be defining mental health. Now, it is impossible to define mental health without defining physical health. And as we go on in this presentation, I will be, explaining why this is so. WHO explained and defined physical health to be a state of complete physical, mental, and social well-being. And he said it's not merely the absence of disease. Most of us believe that if you don't have hypertension, you don't have high blood pressure, you're in mental health. WHO, World Health Organization, is telling us that this is not so. You might look like you're in physical health, but you might not have physical health. Physical health is a whole look at the whole health, including physical, mental, and your social well-being. Now, talking about mental health, mental health is mentioned under physical health. I usually tell people mental health is a subset of physical health. It's inside physical health. WHO also explains mental health to be a state of well-being in which individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. Next slide, please. Now, I want us to look at the correlation between mental health and physical health. We talked about mental health and physical health. What's the correlation? Mental health includes your emotion, your psychology, maybe, and your mental well-being. It is the disorder of the mind. Physical health is kind of like the disorder of the body. Mental health is the disorder of the mind. And mind, as we all know, is the center of divine operation. And this center of divine operation can be unwell as well. So it's not only when you have high blood pressure that you are not unwell. If you're not unwell in your mind, you are not well. If you're unwell in your mind, you are not well. Now, looking at the correlation of this, I try to link it like when you think of skin, you think of, the usual health. And when you think of mind, you think of your mental health. When you think of heart, you think of your spiritual health. It's like you're saying body, soul, and spirit that we're actually used for. So it's 3 in 1. Your physical health is the one that houses everything. Your physical health has within it the mental health, and it has within it the spiritual health too. Now, there is an analogy I usually, give to people that come around me about mental health. I said your physical health can be likened to a house. In your house, you have a kitchen and you have rooms, okay? So the kitchen is kind of like the center of divine operation. If you're a woman here, you know what I'm talking about. The kitchen is like most houses is like in the center of the house. And it is where things happen. You bring things from outside and you dump it in the kitchen to be processed and be used so that you can do things in other rooms. So now the house is like your physical health. If you're bringing rotten banana, rotten apple, rotten eggs into your kitchen, and you're feeding your house with those things, your house will be unwell. Your kitchen will be unwell. And guess what? Your rooms will be unwell too, because when you go to bed, you're either having abdominal pain, you're unable to sleep, your sleep is tampered with, and everything like that. So kitchen is kind of like a center where things happen. So it's the same thing with our body. It's like our mind is the center of operation. If our mind is unwell, our spiritual health will be affected, and our physical health will also be affected. Mental health has been declared a public health crisis because it was found out that mental health affects every areas of life. You know, I know you heard from my introduction that I'm a public health professional. So you'll be thinking, why are we having public health professional talk to us today? Why don't we have a psychiatrist or a neurologist? Okay, but mental health has been declared a public health crisis because it does not only affect our physical health, it affects everyone around us, and it affects also our community. Let's go to the next slide. So I'm going to talk about the links between mental and physical health. You will ask me, oh, you've been talking about mental and physical health. How do they link? You know, how exactly do they link? There is no health without mental health. And I said it earlier on that mental health is like a subset of physical health. So when you're unwell mentally, then physically you cannot be well. Okay. So the link between depression, researchers have shown that there is a link between depression, schizophrenia, and chronic diseases such as diabetes, hypertension, respiratory illness, obesity, and even infection. And I'm going to talk briefly how this is now. So when you undergo stress, when there is stress or you have anger, you have something that is frightening, you have loss of job and things like that happens to you, events that threatens you, your body sends a signal to your brain to reduce serotonin in the brain, okay? Serotonin will also cause increase of cortisol. Cortisol is a stress hormone, and adrenaline as well. I'm sure most of us have heard about adrenaline, that hormone that makes you fight or fly. So when you see something that is scary, let's say right now, as we're sitting down, a lion appeared to us, you're either ready to fight the lion or to run for your life. Okay, so the hormone that is making you do that is adrenaline, and it's also a stress hormone. So the body will send a signal to your brain like, hey, something is not right. Something is happening. Let there be this hormone to help us out. And this hormone are secreted from adrenal glands. Okay, so under normal circumstances, these hormones are good hormones. They help us, make quick decision. Let's say you lose your job right now, and you're feeling sad about it. The hormones are secreted. What the hormone does is to tell you, okay, so what's the next line? Should I go start looking for a job, apply for another? Should I, go for unemployment? It increases your activity to make you have productive outcome. So that's why this hormone is good. Also, the hormone helps to regulate the use of glucose in the brain, okay? It also helps the function of immune system and helps with fat storage. Very, very good hormone. Now, why do we have to link this hormone with depression if they're good hormone? That's the question you're going to ask me now. They will be linked with good hormone if there is a persistence. These hormones are supposed to come at particular time in your life and to be secreted and to help you adjust to that situation and then to go back to normal. Now, if there is persistence and prolong of these events, and the hormones keep secreting, the hormone would have passed a level that is good for the body. And now what you have is you keep fighting. You're supposed to fight for a short period of time. Now you keep fighting. You're supposed to fight the lion. Now you fought the lion. You're fighting tables. You're fighting TVs, fighting everything around you. Then there is a problem. Or it helps you to regulate your body, your blood glucose. And it keeps secreting. So what will happen is that your blood glucose will keep increasing because it cannot be regulated anymore. And that's how it can lead to obesity and diabetes, because your insulin in your body find it difficult to work well with the amount of glucose that is now secreting, because the cortisol hormone will not stop firing. Also, the immune system, I told you that cortisol is good because it helps with immune system. Now, if it will not stop firing, your immune system will be depressed. And what will happen is that the body will find it difficult to fight infection. So normally when you're attacked with a simple infection, your body cannot fight it, and then it leads to something else. So this is how your body can react to stress, to depression, and to other mental illnesses. And your body reacting to it can now link to and affect your physical health. Mortality rate from cancer and heart rate has been found to be higher among people with depression and heart disease. And this is just because of the hormonal imbalance and, things like that. Next slide. Now, who says, there has been a lot of misconceptions, out there. People just say things that they feel they need to say, or they hear people say, or maybe they've grown up to see happen, or we've seen our parents say. No, misconceptions about mental health conditions, it's widespread, it's everywhere. It's not linked to only Africans alone. It's in United States, it's all over the world. And some of this, I put some of these misconceptions there, and I know there are tons and tons. Okay, some people say strong people don't have mental illness. So when you have mental illness, they said, oh, it's because you're weak. It's because you cannot control yourself. It's because you don't know. But no, that is not true. It is not because you cannot control yourself. That's not why you have mental illness. It's because of the way the body is built and the way your own body, reacts to stress hormones, okay? So some people said, oh, mental illness cannot be seen in children. Don't take your child to those medical doctors. They're just deceiving you. But in actual fact, 50% of mental illness have been seen to develop in mid-teens and 75% by mid-20s. So young adults, young children also have mental issues. They said people that have mental illness cannot be successful at work. Actually, that's not true, because a third of people with mental illness are employed. And you see them every day, you might not even know it. You see them at work, you meet them, and they can work. And it has been proven that working, if we allow people with mental illness to work, it will help them to improve their health and quality of life. Another misconception is that mentally ill people are violent and unpredictable. So you cannot see a mentally ill person that is calm. It has to go with violence and be ready to stab you or something like that. In as much as, yes, violence is attributable to some mental illness, but only 35% of violent acts are attributable to mental illness. Can you imagine that? So actually people that do violent acts, most of them are people you think that they are mentally fit. And some people believe that there is no treatment for mental illness. Once you have mental illness, you have it for life. There's nothing you can do about it. Just accept your fate and sit down at home. This is not true, because mentally ill people, they may get better and they may even recover fully. So there have been different forms of therapy. If you step out and reach out to your physician or psychiatrist, there are different types of therapy. There's behavioral therapy. There's one that is called dialectical therapy, the talk therapy. Just sit down and talk to me. Just release your tension by talking. And interpersonal therapy. And there is also medications, that people use. So there is antidepressants for depression. There is anti-maniac, for maniac, they're different. Even for substance abuse, there is medication for those. So the fact that people are saying that once you are mental illness, you're doomed for life, that is not true, okay? So some people say you can tell by looking. When you see somebody that is mentally ill, you can tell. That's not true. You might be sitting by somebody right now that is mentally ill, so you're not likely to see. Sometimes you can see some signs, but most of the symptoms of mentally ill conditions are not seen by the naked eyes. I remember when I was in medical school and, we started psychiatric, and the first topic we did was going through all the possible symptoms of a mental health issues. At the end of that class, we all looked at ourselves like we are all mentally ill, because if you actually go through all the symptoms of mentally ill person, my dear brother, you're likely to be sick. You're likely to what? You're likely to have one of them, somehow. But like I said, stress is a good thing, so if you have some of those symptoms, sometimes it's a good thing, especially if it's just for a short period. But just know how to regulate it and how to snap yourself out of it. It becomes a problem, a mental health problem, when it's long-lasting and it's persistent. Now, before we go to the next slide, I will like to check the answers. I don't know if I have some answers in the chat about the questions that was asked. Okay. Somebody said madness. Yes, that's very good. That's, in fact, I'm giving that person a round of applause right now. Somebody said madness. I'm trying to read. Somebody said stigma. Yes, that's nice. People are stigmatized when they have mental illness. Somebody said craziness, madness. Yes. Self-care, good. Well-being, depression, hopelessness, suicidal, homicidal. These are very, very wonderful. These are the things that actually come to mind when we think about mental health or mental health illness. Let's go to the next slide now. So from the African perspective, when we hear about mental illness, what's our perspective? How do we handle it? Mental health is largely a taboo in Africa, and I know you will agree with me on that. People feel it is the mother's fault. Like they usually say in Nigeria, like if you're pregnant, don't go out in the sun or at night, something like that. I know some people will correct me here. Don't go out when it's very, very sunny. And some people even say that if you're going out when it's sunny, you should put a pin so that the pin will fight all those evil spirits, and the evil spirits will not come into your tummy. So those are the things that we think about in Africa when we think about mental health. So family of a mentally ill person is seen as cursed. They think, oh, the person is cursed from heaven, and people don't want to associate with them so much that families, some of these families chain and hide them for fear of discrimination or even ostracism. They don't want to be cast out of the community. Then what's the religious perspective? We're all from Africa here. When you think about mental health in Nigeria, they take these people to churches or to the herbalists and chain them down. I can, figure out or think about, some white churches, they have these palm fronts and start beating the person because we believe we have to beat all those evil spirits out of the person. It is a very, very sensitive structure. Like I said in my introduction, you cannot talk about mental health without talking about spiritual health. There is a form of spirituality in it, but you cannot talk about the spiritual without talking about the medical aspect of your public health aspect of it. So if a person is ill, what we do in Africa is to, take them to churches and have them go through deliverance, have them beaten and all that. Those are wrong perspective of looking at mental health issues. And then there are some beliefs that they are spiritual beings. So some people will not even bring their family members that are going through challenges, mental health challenges. They won't bring them out to medical professionals to see, because they believe that they are spiritual beings. I don't know if any of you have heard about this. They believe that they can see into the spiritual world, they can see into things. So they actually harbor them and then use them. Let me put it that way. There are some aspects like that they keep them and use them, like, okay, we are okay with the way the person is. It's just once in a month. When he goes like that, he receives spiritual instruction for us. And I'm going to, say a very, very funny story about this. When I was in medical school, myself and my friend, we were going for a clinical, I remember, and standing by the roadside, waiting for, the shuttle to come, there was this mentally ill woman that came by. And the woman looked at me and said, you're going to America. You will go to America. And he looked at my friend and said, you're going to London. You're going to London. Oh man, we are still medical school students struggling. We're not thinking of going out of the country. We just want to finish our school and pass and then contribute to the community, and that's it. So we look at each other, we're like, oh my God, what's going on? We moved away from there. And this mad woman started coming after us and say, wait. But we didn't wait, okay? So in a nutshell, I'm now in United States of America, even though at that time I wasn't thinking about it. This my friend is in London as we speak. So that aspect, I'm saying it with a very, very pinch of salt, because this is what has happened to me. I don't know if it's coincidental. You can call it coincidental, you can call it whatever, but this is what people believe, because they've seen it happen. They tend to keep such people so that they can bring spiritual instructions to them. But this is not right. Your mental health has to receive treatment, and your spiritual health has to receive treatment. Your body has to receive treatment. If you have to be well physically, all these three components of your life has to be well. Remember, WHO said that physical health is a complete well-being. You cannot say that, oh, I'm not sick, then I am well. It is a complete well-being. Let's go to the next slide. So how do you see, I asked us, like, okay, when you hear this mental, what comes to mind? From Nigerian perspective, we think about arrow, yaba, left hand. Is it left hand or right hand? Left hand, I think. Madness, like some of you said, dirty people in rags, people talking to self. You see a form of darkness, like people that are out of this world, that they are not where you are, they're in their own clone. Or you think about drug use. People believe that people that have mental illness actually bring it on themselves. Oh, it's their handiwork, is because they use drug. It is not everybody that is mentally ill that is using a form of substance, okay? They believe that they're caused, or their mom went out in the afternoon, sunny afternoon, when the mom was pregnant with a person. Psycho, we call them freak. Some people call them loser, wacko, animal, maniac, evil. Is this what you see? Is this your diagnosis of the brain of a mentally challenged person when you see them? Or do you rather see a person, somebody that is like you, that needs to be understood, helped, and loved. If you will not look down on somebody that have high blood pressure, why will you look down on somebody that is mentally challenged? Okay, if you will not drag somebody that has high blood pressure to a church to be beaten, to drag high blood pressure out of the person, why will you do that to somebody that has mentally challenged, that has mental challenges? So now, these people are people like us. They just need to be understood. They need to be loved. They need to be helped. And they need to be shown resources. So, that's about what exactly and how do you see mentally challenged people? Next slide. So now, when you talk about mentally challenged people or mental health generally, are this what you see? If you can see my slide, are this what you see? This first person, second person, that third one is in a room that is chained down. This person has tire around him, haggard, locked ears, rag, dirty, probably stinking, Are this what you see? Do you see the other picture whereby there are so many people living in the person's head? There are so many voices talking to the person. Is this what you see? Next slide. Or do you see this? This person, wrongly dressed, and this person neatly dressed, and this person neatly dressed. What do you see? Okay. Now, if you go back to this person that did the guy in blue suit, I'm sure most of us know him. He's a comedian in Nigeria, Arole. And the other guy in yellow is a student in a university in Nigeria. Very, very talented, very, very knowledgeable, and is a sports, guy. Now, let's go back to the previous slide. So the first person in this picture here, that is Arole. That is the guy in blue suit. That is him. I saw this picture online. He is not mentally challenged. Please don't take me wrong. He dressed himself like this just to create a form of awareness. He just dressed, it's just for a section. He dressed himself because people feel that once you see this person, the person is a mad person. Arole is not a mad person, but that is the picture. So talking about what you see. The other talented young guy in the next slide, that is the second picture here. This is rag day. This boy dressed in rag and walked down the street of, I don't know, maybe it's Lagos, I can't remember where that place, just to create awareness. He is not mentally challenged. So if you're hoping to see somebody to be dressed like this, to think for them to be mentally challenged, then you're wrong. And if you're already judging everybody that is dressed like this or close to this to be mentally challenged, you might be wrong. Then the other last picture, the one that has tie around the neck, this person is not mentally challenged. This person is just framing to be mentally challenged so that he could dupe people or get money out of people. He was caught in Lagos. I saw that picture too online. So he's not mentally challenged. So most people that are mentally challenged, you might see them in clean clothes. If they don't tell you, you might not know. And this is why you need to show love to people that you see, because what you see is not actually what it really is. Okay, now let's go back to the next slide. Thank you. Okay, so now this other person that is going through the dumpsters, the two pictures, they're actually going through the dumpsters. They are not mentally challenged. They look it, but they are not. These people are hardworking Nigerians finding food, to put food on their table. So if you're waiting to see somebody dressed in rag on dumpsters, picking things from dumpsters to label them as mentally challenged, then you're wrong. Now look at this other picture in that place. That is mentally challenged. That empty frame that you see there is mentally challenged. The other pictures that I've shown earlier on, yeah, misconceptions or misunderstandings. This empty picture is the mentally challenged. And I put that frame there because that could be me and it could be you. That could be a friend, it could be a family, it could be a co-worker, it could be the most intelligent person in the world. I've heard of celebrities that had mentally challenged, mental illnesses. I've had presidents that have it, and they're still functional. So this one, the empty frame, is the actual mental challenge. This is the reason why we have to understand what mental illness is, what mental health is, what the illnesses look like. And we have to understand why we should show love to everyone around us without discrimination. Next slide. So now, having said all this, then you want to ask questions. So why do people have mental illness? Why? Why do some people have it and some people don't have it? We've talked about stress hormone, high cortisol in the body, and how I talked, briefly about how they're produced. If you have stress, if you have some events that cause you to need to react, the body will send signal to your brain to produce cortisol, which is stress hormone, to help you cope for that moment. But by the time it gets prolonged, then there will be trouble. So high cortisol is known as stress hormone. It's a sad hormone. They call it sad hormone, but I don't see it as sad hormone because it has its own good effects. Low dopamine. Dopamine is supposed to be a happy hormone. When you're happy, dopamine is the one that is secreted. You're happy, you want to dance, you want to do this. So when there is low dopamine as well, and which high cortisol can do, high cortisol can depress your dopamine level. So when there is low on that, then you'll be looking at some mental illness. The same way, you don't want there to be too much firing of dopamine as well, or else you keep dancing around the streets. I know in my introduction, you mentioned that at my leisure time, I dance and all that. Yes, I dance, but I don't have too much of this dopamine, or else you will see me dancing the streets of Columbus. Now, what other things can cause social mental health issues? Social determinants of health. Social determinants of health, it talks about where we live, worship, school, work, everything, our environment, where we live. That's social determinant of health. And they also determine this effect. It talks about your financial stability, the educational level, access to healthcare, and the people that live in your neighborhood. They have a way of affecting your stress hormone. For instance, people that live in low poverty areas, people that live in high poverty areas have their stress increased because you have to struggle and wake up in the morning, try to get how to go to work, you struggle to get work, there are gunshots in your area and things like that. So that's one of the things, that can affect mental health. Then life experiences and events, the trauma you've gone through, loss, separation, And can we say anything these days without talking about COVID? COVID itself is a very, very significant, in fact, it should be a whole factor by itself. During COVID, in the past few years, we've seen losses, we've seen death, we've seen sicknesses, we've seen separation, loneliness, and different things that can easily, tip people to stress and tip people to having depression and other mental illnesses. And then genetics as well. Children of parents with, for instance, chronic anxiety disorder are 2 to 6 times more likely to have anxiety. Now, talking about that, does it mean that if your parents have mental illness, you must have mental illness? No. It means that you are more susceptible to having mental illness than children from parents who do not have history of mental illness. So if you understand that, you have to keep your stress level low, you have to visit your doctor regularly, you have to talk to people so that you don't get to that level of mental illnesses. Habits and lifestyle as well, substance abuse, sleep. Sleep is very important. The food choices, the food you eat, and exercises, all these things can have effect on mental health. And talking about the food choices as well, I also call media as a form of food. So be careful what you feed yourself on from the media, because they can also affect your health. There are so many news going on around us that are not, good for us. So sometimes you may need to tone it down or balance it up. Then events that have occurred in your life, postpartum. And postpartum too, it's okay, let me quickly talk about that. So after having baby, hormonal imbalances have contributions to this particular factor. So cortisol is produced more during this time, and it's a good hormone. It helps you secrete, it helps with breast milk production and all that. But if it's too much, it is firing at a very high level, then it can lead to postpartum depression. Next slide. So how common is mental health illness? Is it really common? Do we really have it? Some people even believe that because we have a lot of mentally challenged people on the street of Lagos, maybe we don't have much of mental illness in America. That is not true. The reason is that, America has, institutions and things like that. So there are about more than 500 categories of mental health illnesses. So it is very common. It is real. It happens. If it's not happening to anyone around you, know that it is real. Okay. And WHO says it will affect 1 in 4 people globally at some point in their life. 1 in 4 people. So if we have 4 in this room, look around you, it's likely 1. So 25% of people will have mental illness at one point of their life. And it affects 1 in 5 American adults, 1 in 6 young people. Immigrants, like you and I, we have 19% in first generation immigrants, 35% in second generation immigrant, and 55% in third generation immigrants. Can you see how the gradients goes? So this is very, very scary. And I think it is good that we are all talking about this right now. If there is a way we can curb it or come in through the chain and cut it, it will help us in future, because if our third generation immigrants are having 55% of third generation immigrants are having mental health illness, what are we going to say about fourth, fifth, sixth generation? That is why we have to understand mental health and plan to do something about it. In 2015, about 7 million Nigerians have depression. I saw this and I was like, wow, 7 million in 2015. Look at 2015 till now, politically in Nigeria. See so many things that have gone down, that have degraded. If we are having 7 million in 2015, I wonder how many we will be having today. Now that there is unrest, kidnapping, COVID, different kind of things happening that were not happening in 2015. So, and this 7 million are people that are reporting, people that reported to a mental health institution or to their physician, and they were diagnosed as having mental health illness. So think about number of people that are mentally challenged and are on the streets of Lagos and all over Nigeria. Suicide is the leading cause of death in US. So that shows how common mental health illness is. Next slide. Common mental health issues. Okay, I said most of this earlier on. Mental health can start from little, triggers that we have in life, like loss of job, sadness, I need to pay my bills, and stuff like that. It brings, some kind of hormone in you, like, what should I do now? And things like that. But if it's for a short-term period, it is good. But if it's extended, then there is trouble. So we have short-term anxiety, like you have a first date, you're meeting your girlfriend for the first time, and you're like, you don't know what to say, you don't know how she's going to take you, and things like that. Or compare with general anxiety disorder, okay? The fight and flight is firing and continuously at low levels, okay? So when you have general anxiety disorder, the fight and flight that we talked about, the cortisol level is firing at low levels constantly, 24/7 all through the day. Then it increases, randomly on random occasions. So that at that time, then you're having general anxiety disorder. This is no longer the short-term anxiety that you have when you need to go and meet your boss, or you have a presentation, or you have your first date. And it's usually diagnosed when the symptoms have persisted for 6 months or more. So also we have panic attack and panic disorder. So panic attack are like stressful events, like something happens, you're like scared and you can feel your heartbeat. It's okay, it happens, it helps you cope with situation if it is for a short period. But by the time it gets prolonged, then it becomes panic disorder. It becomes recurrent and unexpected. Maybe you're just waking up in the morning and you're having palpitation and you're scared and you're panicking for no reason. Then that is mental health illness. Then sadness compared to depression. We've talked about this, in so many examples. You lose your job, you're sad, you're thinking, what should I do? How should I do? But when you let that sadness prolong or stay for a long time, then it becomes depression. And, sadness, like we know, there are so many symptoms of it. You have mood swing, mood loss of interest. You see people telling you that, oh, there is nothing in this world. Let us just end it. Let us, they don't want to do anything. You don't want to work anymore. And it can also trigger to, suicidal ideation, like, is it not better for me to just die? If you ever think that, or if you ever hear somebody mention something close or put it on their Facebook account, please run to rescue that person. Whether you think the person is joking or not, in this age of pranks, don't take things like that as prank. Run to rescue that person, because that person can actually be rescued. It can be taken to a physician and be given antidepressant, and you can return 100% back to normal. Depression affects 1 in 10 people, and that women are 2 times more than men. You know us, we can think, we can worry, we can think so much about things. We'll start worrying about what we eat next week from today. So, it's not surprising to see that women have more than men. So, yeah, I just mentioned that there are different types of depression. You have depressive episode, bipolar disorder, postnatal seasonal affective disorder. That's also a form of depression that comes with season changes. Some people don't like winter. Once it's winter, then their depression starts. So that's also a form of depression. Next slide. So what should I do? You know, we've been talking about, okay, we know now it is real. Now, yes, we know. So what should I do? What I will ask you to do is to mind your mind. Mind your mind is very important. Mind your mind means pay attention to things that has to do with your mind. Pay very close attention to it. Be intentional about your mental and physical well-being. Don't take it for granted. Make you a priority. Make your mental health a priority. The healing starts from you. Before you can help others, you have to be able to help yourself. You have to be sane and sound to be able to help others to do the same. So be intentional, make your mental health a priority. By the time you start to see some mood swing changes that are prolonging, some changes, some people will overeat, some people will not eat at all. And that's one of the signs of depression. If you're seeing changes that you don't like, talk to somebody. Make it a priority. Then pay attention to your rest. That's supposed to be rest, not EST. That's a typo. Pay attention to your rest, R-E-S-T. Calm down, calm down. We all remember that video. Calm down, be calming down, mommy. Yes, we all need that word in our life. We need to calm down. You see, whatever will happen will still happen, okay? It is not by you worrying about it that will change it. It is what you do. So it is better for you to think about it and plan action about what you can do. If you lose your job, you've lost your job, there's nothing you can do about it. What you should do right now is think about, how can I get a new job? Or should I just use this period to go to school and improve myself? Don't sit down and start crying like, I know the reason why I lose my job. The guy does not like me. That is not it. So pay attention to your rest. Calm down. And by rest, I now broke it down. What is the rest that you're supposed to pay attention to? The first one is your relationship. You cannot do life alone. Pay attention to your relationship. Help people around you, your family, your friends, and then they will help you in return. Pay very close attention. And I usually say as well, pay attention to your higher relationship too. We all have this higher being that we believe in. Higher being that you believe in. If it's Allah, if it's God Almighty, if it's Jesus, pay close attention, because the healing that happens in your spiritual life affects your mind as well. Also pay attention to your genetics. What happens to your parents? Do you have history of mental illness in your family? So with that, you pay attention to yourself and you seek and talk to somebody about that. Pay attention to your environment. We are all immigrants. We move from one place to the other. And so there are so many things that are changing. Culture shock. If I ask you questions about cultural shock now, every one of us will have something to say. So we need to pay attention to the new environment we have right now. See what you need to adapt to, see what you need to change, and see what you need to reject. You don't have to take everything that America has to offer. America is a good place, but we do not have to take everything that they have to offer. Pay close attention. See the one that will benefit your mind health, your mental health. Take those, and the ones that will not be of benefit to you, drop them. Connect to friends, to family, connect. Build your own village. Don't do life alone, okay? And that's really very important about environment. Then pay close attention to yourself. I've already said it. Own your mental health wellness. Let it be a priority. Be the first person to take care of you, okay? Do self-care. Take care of yourself. If you need pampering, do some pampering. If you need, whatever you need to do, you need to sleep, create time to sleep, Do medical checkup, annual medical checkup, do that. I know here in America, we all work a lot. We work because, of course, we have responsibilities back at home and all that. But in the midst of all that, create time for you, okay? Create time to do medical checkup, to stop and ponder. Watch your habits, watch what you eat, what you feed yourself. I talked about the kitchen the other time. If you bring something rotten from the outside into the kitchen, the house will be affected. If it's smelling in the kitchen, it will smell in the house and it will smell in the room. So if you bring in something wrong into the house, then you will be affected. Thoughts. Think very, very important about what you think about. That is very, very important. What are the things that comes to your mind? Process them. Things that are not healthy, take them out. Only ponder on things that are healthy. Think positive. It helps. If you begin to think negative, it increases your cortisol hormone. And before you know it, gradually, it tends to push you from sadness into depression. So if you think you can do something, that's one saying that I hear people say that I really like. If you think you can do something or you think you cannot, you're both right. So if you think you can, then you can. If you think you cannot, then you cannot. So be careful what you bring into you in form of thoughts. Then speak out. Speak out. If you don't speak out, you will be doing life alone. By the time you begin to speak out, you will discover that you are not the only one in whatever situation you're in. So like I said, find your village, speak out about it. And if you have such, such examples, such experience, speak out so that it can help other people too. When they see that someone has gone through it and is coming on the other side strong, then they know that they can also go through it as well. And reach out to people and seek help. Next slide. Now your role in the community, I said you have to help yourself. Once you're able to help yourself, then you can help your community. Provide appropriate support, no stigmatization. That's somebody, when I talked about what comes to mind when you think about mental health, somebody says stigma. Yes, it's very huge. It is happening in Nigeria. It is happening in America. It's happening all over the world. They look down on you once you say that you have depression. They look down on you once they know that there is somebody in your family that has a mental health illness. As a matter of fact, in Nigeria, nobody will marry from that family. They will just be like, avoid that family. So try and embrace and include those people that are going through such silent challenges. No stigmatization, don't judge them, be free and easy to forgive. Just let things go. And then pay close attention to them. You might be the only one to recognize that there's changes in their mental health issue. So pay close attention to them and what they're showing. Stay in connection with your community people and listen to people. Like I said earlier, one of the therapy is talk therapy. Just sitting down and listen to people talk, pour out their heart. It's a form of therapy because, like I said, some people has gone through a lot of losses. That's another huge form of mental health. Losses can be in form of you're losing a family member, you lose a job, you lose what you're used to by moving from Nigeria to America. You're losing some things. You're losing, connection with some people. You're losing something, your marriage, separation, different kind of thing. So listen to people, and just ordinary listening, we go a long way to help them. Then learn more. We can learn enough. You still keep learning every day. Learn more. There was a time I told a friend to go for this, and he was like, why are you asking me to go for that mental health, this thing? I don't have that challenge. And I said, it might not be for you. It might be for somebody tomorrow. You don't even know the person that you will use the knowledge that you're gaining today. You don't know the person that you might use it to help. But then it's very important to learn more about it, because what you don't know, you cannot give. It is what you have and you know about that you're able to use to help people. Next slide. So no stigma, no stigma. So Clinton said, mental illness is nothing to be ashamed of. I know it's difficult to say because the stigma has gone so deep that breaking it now is like breaking a huge rock. But then we will get there. It is nothing to be ashamed of. Speak out. He said, but stigma and bias shame us all. Next slide. So that's the end of my presentation today. Thank you guys for inviting me, and thank you for listening. I will now take question. Next slide.
So thank you so much again, Dr. Aluko, for that beautiful presentation. There are one or two questions that slid in while you were speaking. I'll raise one, and I just had the other one. But I think in a quick summary, I think you've been able to not just mention what we do here in the United States, but what you also do vis-a-vis our background from Nigeria. So thank you for putting that little touch to it. I think we appreciate that. I think a bit more, you educated us more about mental health and how to not perceive things over the other. So I did like that. One thing I did actually think was missing and distressing also is vacation. I know you did it in different ways, but I think vacation is big for me, and I saw it in what you talked about, and I think that's huge. But someone did ask a question, and I think there's a hand or two raised up too, but I'll pick the one we had in the chat. And I think you've touched on it, but I think maybe there's a little bit more clarification needed already on it. And the question goes, how do we fight the misconception around mental health? How do we fight the misconception around mental health?
Thank you. Before I answer that question, and that's a very good one that you brought about vacation. It's one of the things I plan to talk about, but having this period is not enough to go through everything you have or you think you might want to go through under mental health. There are huge things that you can go through. And that comes under self-help, self-care. I said you should mind your rest. And the S in that rest is self-care. So self-care can be anything to anyone. Like you said, because like you said, for you, it is vacation. So it is actually taking time out of the stressful events, okay? Anything that will pull you out of the stressful events, take the trigger of the hormone around you away for that short period of time is really helpful. And the way it's helpful is that when you move yourself, so there are two ways. You can either move the stressful situation out of your way, or you move your own self out of the stressful situation. So vacation is a way of removing yourself out of the stressful situation and go somewhere. Some people like beach, go by the beach. Some people like to go to Nigeria, which is beautiful. Go and relax. I have a friend, she will just go and spend a weekend in an hotel. It's like, I need to get off the kids and get somebody to take care of the kid. Go take herself outside that stressful situation, go to a hotel, relax for that period. What that helps you is it normalizes your stress hormone. Okay, so by the time you come back, the stress hormone will have been inhibited. So the firing will not continue. So vacation is a very, very good one out of it. Some people like to be pampered. I mentioned pampering. They just go and do the nails, do pedicure, manicure feel good about themselves. Some people will even do window shopping. Just make sure when you're shopping, don't spend the money that you don't have, because that eventually will add stress to you. But window shopping is legal in America. Just check it and look like, it looks good. It makes you feel good about yourself, then do it. All right, now to the question, how do we fight misconceptions around us? I think I get that question right. So one way of doing that is, number one, to identify and understand that there are misconceptions and there are people that truly do not know. They just do not know. And the way to do it, to fight it is, which is one of the things we're doing right now. We're learning more about mental health, learning more what the misconceptions are. Then you talk to people around you about mental health, listen to them, and try to correct them, okay? So sometimes it is done from individual level, it is done from the state level, from the government level, it is done from organizational level, like in Columbus Public Health has so many avenues by which they go out and then give health education to people to let them know that, hey, if this is what you're thinking, that is not it. And some people also do focus groups. So they go to area or groups that they think are vulnerable and then create focus group, create a platform, an avenue for them to speak their mind. Because not everybody wants to tell you about what is going on within them. But if you create a platform that is welcoming and inviting, you will find the person, talking. If you have a story to tell, and you tell your story, you make the person feel more relaxed and trusting towards you to tell you her story. And by that time, you'll be able to tell the person, hey, this is not right, this is not this. So we can fight, like I said, we can fight in different levels, but you have to start from yourself. You have to start from where you are. You have to start from your friends. If you go out with your friend, just mention something about mental health, see what they will say about it, and try to correct their misconceptions. I hope that answers the question.
Thank you very much. Yes, I believe the questionnaire did catch that. I think we do have Frank. I think you have a question. Go ahead. I have tried to mute you. Go ahead and unmute yourself and you can ask a live question.
Hello. Can
Hi.
you guys hear me?
Yeah, we can hear you.
Thank you, Dr. Seun. That was very interesting and informative. I have the tendency to be more traditional with regards to medicine. I do not believe that modern medicine does everything, and I do believe that modern medicine does a lot. So my question is, what is the history, especially with regards to Africa, Nigeria? What's the history? Is it that it has always been that mental health has always been treated in such a bad manner, or were there any forms of treatment historically before this modern medicine treatment comes into place? I really would like to know if such happenings, if ever. That's my question.
Okay, thank you so much for that question. Actually, not even talking about Nigeria, all over the world, mental health has been emerging and is still emerging. So we are discovering new things about mental health every day. And like I said, mental health just became public health issue, I think last year or 2 years ago. So it's because so many things are getting into limelight under mental health. So even in America, there was a time that these medications were not in existence, okay? So not to talk of, Africa. So there was a time that there was no medication in existence, and people have been coping the best way they know how to. The history about Nigeria, I don't really know the deep history about how it was going that time, but what I know is that there was a time that medication was not available. And if you look at closely at that time, we want to think, how many people have we lost to mental health issue during that time? How many people died of suicidal ideation, just killed themselves due to mental health issue that we do not know? But as researches comes in and medicine emerge, so many medications are coming into limelight. Even in antidepressants, we have some new generation antidepressants that are being tested and used on patients for their mental health illnesses. Okay, so now you talk about the traditional way and the physical way and the modern medicine way. So the traditional way to, like I mentioned, during my presentation, I said you should pay attention to your relationship, to whatever you think is your higher being. If you think it's God, if you think it's Allah, if you think it's traditional, whatever, pay attention, because there is a form of healing from that place. At the same time, I do not believe that 100% the healing of mental health is from whatever the higher being is, the unorthodox healing. But I mean, if it does not hurt you, you can do it. You can get, things to use and everything like that, but do not discard the modern medicine way. The reason why the modern medicine is very important is that it's emerging. Researches are going on. They are discovering more things to help people. And now people are being helped more than, it used to be. So it's very important. And also talking about unorthodox way, is not all the modern medical way that is medications. Like I said, we have therapies, we have behavioral therapies. We just talk to people and try to help them mold and shape their lifestyle and way of life and way of thinking. That's behavioral. We have talk therapy, dialectical therapy, things that you don't even have to swallow any pill, and still they are helpful in this. And that also is also in the history in Nigeria as well. Some people go and talk to their pastor, they go for counseling sessions, and their pastor will sit them down and listen to them talk and advise them to shape and modify their lifestyle. And that actually goes a long way in helping, treating, and managing mental health issues.
Thank you very much. That was well received. Thank you.
Thank you.
Thank you so much. And before we finally wrap up, are there any other questions that we have missed or you want to ask directly to our speaker? I think Reverend Dr. Fawale, are you trying to say something, sir?
Okay, since you called the name, maybe I should say something. Thank you so much, Dr. Aluko. Did I pronounce the name right?
Yes, sir.
Yeah, for your great presentation. I will say this, I will be reaching out to you. I'm in New Jersey, and we as clergies will need your help. I'm quite sure my statement here is not new to you. I don't want to be too elaborate, but again, how rampant this is growing within even the clergies that you say should be giving counseling, which is all right. But again, some of us, as I'm included, I would not like to say some of them, we are battling with a lot. And again, with the church pressure and what have you, financial situation and all those things. So I'm putting a program together, which I will reach out to you. I don't know if you want to send me, which I don't mean your private number, but is it the number on the screen that I should use in trying to reach to you?
Yeah, we can communicate that to you.
Yeah, you can get in
But-
touch with the organizers. I don't know the number on this phone right now.
Okay, no problem. Thank you so much.
Thank you.
Thank you, sir. And I see in the chat that somebody said, hope that the medical professionals in Africa can begin to pay attention to this illness. That's very, very important because there is something that we do like train the trainers. We actually train medical professionals to pay attention because sometimes, medical doctors have different area of specialties. And I may be a physician, somebody is coming to me with high blood pressure, hypertension, whatever that is. So we're trying to train them and let them know that you have to treat the holistic of the person. It's not just the mental, it's not just the physical problems that they're bringing, it's not just the high blood pressure. We're also training them to let them know that you have to pay attention to their mental health issue as well, and then to be able to refer them to appropriate sector when needed. So yes, this is ongoing, and the awareness is going more wide in Nigeria right now. I have some colleagues in Nigeria that are really, really into this, and doctors are paying close attention to the wholeness of the patient now. Thank you.
Thank you. And
Hello.
I think the last one. Hello, Dr. Odita, did you have a question?
Yeah, it's a kind of question and comment.
Okay. Go ahead, sir.
Yeah, I really, really, really appreciate this lecture. It just covered a whole wide areas of mental health, and I think everybody that listens carefully will really get a lot out of it. And I thank the speaker for making this presentation. One thing I wanted to stress or make clear, because we seem to aggregate everybody that says something unusual or behaves in a way as mentally deranged or disturbed. But I want to point out that, for example, when she gave example of the person who told her when she was in the university that she will one day be in America, and told the other person she will one day be in London. I mean, you cannot characterize this person as having a mental illness. You see, because there is nothing really wrong with the person. And in short, what I'm trying to stress is that there are people, as she mentioned in her lecture, and advised us that the way to combat mental illness is to turn ourselves to the greater power, whether it's God, whether it's Allah, whether it's this or that. So what I want to point out is that there are people who have done that and have attuned themselves to the higher powers. And the higher powers are using them to help the community. If we go back, Christians, to the Bible, you remember John the Baptist could be called a deranged person because he pointed out the evil that Herod was doing. Well, John the Baptist not mentally deranged. In fact, he was the forerunner of Christ. So we have to really differentiate between people who are expressing divine information that will help society from people who are really not doing something that will be helpful. So that's my point anyway.
Thank you, sir. I really, appreciate that you're bringing that up. And I mentioned it, somewhere in my presentation as well. Like, it's not all mental health illness that you can see. And so what do you see? When you see somebody dressed in rags, do you see a sick person? Or do you see somebody that is just trying to fend for a living on a dumpster? Do you see a sick person, or do you see a student that is just doing rag day to raise awareness about mental health issues? Okay, so sometimes we can see, most of the time, you cannot see these mental health illnesses. And I also mentioned that when you talk about the mental health illness, you're talking about the illness that concern your mind. And there is also spiritual illnesses too, that the one that concerns your spiritual being, okay? So if you're sick mentally, it can affect your spiritual wellness. And if you're sick spiritually, it can affect your mental wellness. So you cannot take one out of the other. They are all interlinked. And that is why WHO said that it is not the absence of disease that we're talking about right now. We're talking about the wholesome of a whole total person, a wholesome in your mind, soul, and spirit. And we cannot take up the factor of a higher being, a God. Definitely we cannot. At the same time, you cannot overlook the other aspects and face like what happens in some parts of Nigeria. They usually face like, oh, it is spiritual alone. And then they take them to White Garment Church where they're giving holy water and everything. I don't have anything about that. If you believe in that, if it works for you, it will work for you. But you cannot face that alone and not face your mind. It's just like I said, like we're doing training the trainers. You cannot go to a doctor and say, check my blood pressure, and the blood pressure is high, and the doctor said, oh, your blood pressure is high, I'm going to give you amlodipine, go and sleep. Go, that's it, just use amlodipine. If the high blood pressure is coming as a result of some stress that is happening around you and the stress is not removed, your mind is still rotten, your body is getting healed. So it's just a matter of time, it will come back. So, it will not be totally healed. But until a professional starts to see a person as a total human being, I'm treating your high blood pressure, I'm checking for your mental wellness and sending you appropriate therapy, and I'm checking that you're whole spiritually as well, then we are not ready to start talking about physical health. And thank you so much for talking about that.
Thank you.
Yeah.
We are actually at the top of the hour and actually a little bit overshot, but there's one question, and if you don't mind, Dr. Aluko, to just give us like a 1 minute reprise on that and maybe wrap up the session. The question is, how do you deal with people? And I apologize to everyone. We've shut up a few minutes, but we will wrap up now. The question goes, how do you deal with people in social authority that monetize mental health? I think more like it is, how do we deal with people that are trying to monetize mental health against us? Just a quick wrap up on that.
Well, that's a little bit political. But as political as that question is, does it even not start from us as an individual? Do we not see individual human beings monetizing mental health? In one of the pictures I show, as in what do you see mental health as, I show a person that claimed to be mentally ill just because he wants to get money from people. You know, even individuals, they are so desperate to monetize this mental health issue that they are claiming to be ill, to be mentally unwell, so that they can get money. It flows from that. It flows from that to, you know, organization, and it flows from that to, you know, government, social. It is very disheartening. It's not something that could get settled in one day, but one step at a time. As we begin to talk about mental health and how mental health, you know, issue affect us as a nation, then we will get to that. And we have to have them to be transparent, because some people get funds from the government to be able to help mental health, wellness, and awareness. So being transparent and being accountable, asking them, you know, about this fund, it's one way that I believe we can, you know, start moving towards that progress.
Okay.
Okay.
Hello?
Bukola, you are muted. Bukola, you are muted.
Oh, I've been speaking for a while without even hearing.
Yes,
I apologize.
you are muted.
I said thank you again for being part of this session.
Thank you for having me.
Wanted to really appreciate your time, even though we reached out last minute, we were able to deliver. If you don't mind, we're going to take this very important education that you have given to us. We're going to put it on our website also, and we're going to be able to also share it with our other community and our larger community. Mental health is a challenging topic, so it's understandable when people are scared of having that conversation, but we are hoping to take this education you've given to us and share with our larger community. And to everyone that actually took time to stay to the end, thank you. And we hope to actually have sessions like this with some great expertise that are coming through. Dr. Aluko, anything last words as we wrap up now?
Well, as a last minute word, what I want to reemphasize is that you should pay close attention to your rest. It's very important. Rest, your relationship, your environment, your self-care, you know, everything that concerns you, pay close attention to it. And also reach out to help people. Make sure stigma is tapped to the end concerning mental health. And I wish us all well mentally and physically.